Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome to Understanding the Human Condition with your host, Dr. James Flowers.
How are you, Robin?
I'm good. How are you?
I'm great. I'm so excited to have our friend, Dr. Clay.
Yeah, and I'm sure our female audience is excited too.
I think everybody's excited.
I think so. Welcome.
Yes, thank you. It was a pleasure to be here. Thanks for having me on the show.
You bet.
Well, thanks for joining us. I thought I'd read a little bio to
Yeah,
get us
please.
started.
Yeah, go ahead.
And then we'll have some good conversation here. Owner of Sculpt-U Physical Therapy in Houston, Texas, Dr. Clay graduated with his doctorate degree in physical therapy from Ithaca College in 2015. He has a strong passion for bridging the gap between rehab and return to sport, as he is also Certified Strength and Conditioning Specialist, a CSCS.
Yep, that's what that stands for.
Awesome. Clay Ardoin.
That's right.
Or Dr. Clay.
Dr. Most people
I'm just going to start with
most
that.
people go with
Yeah,
Dr. Clay.
That's all I'm going to
Yeah.
call you.
My brother was the first doctor, so he goes by Dr. Ardoin usually. But I just go by Dr. Clay.
Okay,
Nice.
Most of the time.
good to know.
Yeah.
Yeah.
So years ago, physical therapy, to be a physical therapist, you didn't have to have the doctorate, right?
That's correct. Yep.
And then when you went on to school, what happened? Why'd they? I'm glad they did.
Yeah, I'm glad they did too. Honestly, I think it was the curriculum. The curriculum is the exact same. So I think it was more of a financial thing probably for the schools.
Exactly.
They have an exponentially more amount of PT programs around the country now. It used to be very small niche.
Yeah.
But now a lot of people are trying to get into rehab and physical therapy. So everybody that practices now has to have their doctorate. And,
oh, wow.
And even for the older therapists, they have bridging programs for them to become doctors.
Yeah.
So.
And it's not easy to get into physical therapy school.
No,
I
it's
pretty competitive.
Very,
Is
very,
it?
very difficult now. I've said
Yeah.
a lot of people are trying to get in, and they're making it very competitive.
Yeah, they are.
What
Yeah.
sparked your passion to get into this?
Oh, a lot of different things. I was always an athlete growing up, and played 3 sports in high school, and had my fair share of injuries way back then, and had a great therapist, and he kind of sparked my interest for rehabbing and stuff. And I knew fitness was always going to be part of my lifestyle, and I really wanted to learn how to create longevity and learn how to train. I've met so many different people in all different walks of life that say I wish I knew now what I knew back then. So kind of made me want to go down that path.
Yeah.
And my business partner and my brother is also a doctor of physical therapy, and he started out first and kind of set the pathway for me, and that was about 10 years ago. So
did he encourage you to go to school and become a physical therapist?
He did actually. He was a big role model for me in that regard.
Cool.
So I'm glad that he did that.
Yeah.
Like I said, we're business partners now, so we were able to develop a good relationship, working relationship, and it's been really, 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 really great.
Well, you guys work with virtually every one of our patients at J. Flowers Health Institute over at the Houstonian, and you see quite a bit of acute pain and quite a bit of chronic pain, which is kind of my core clinical specialty. But what's your philosophy in physical therapy working with an unrelenting chronic pain issue with someone?
That's a great question, and it's very, very complex.
Yeah.
It's first understanding what is happening with the patient. There's so many different things that patient can be experiencing that can be affecting their pain, and it's very hard to get them to understand. Pain is, and the research shows this, and as you know, pain is 100% produced by the brain.
Yep.
It's not by tissue damage. It's not by It doesn't matter if it's acute, it doesn't matter if it's chronic, how long it's been there.
Right.
There's a lot of different factors that play into chronic pain. One of them is the medical system. Medication's okay. It's okay to get on medication, but that needs to be tapered off and weaned. A lot of times patients are on there way too long.
Yeah.
Right? Then there's the patient's mental and emotional response to that, right?
Yep.
How much stress do they have in their lives? What can you do to reduce that stress around that area, right?
Yep.
There's their lifestyle and their habits, things like that, their diet.
Yep.
All those things can be improved on when you're dealing with chronic pain. That can really help to desensitize the nervous system, because at the end of the day, that's what we're trying to do, is drive down your neural sensitivity to the situation.
Exactly.
Right?
Yeah, that's right.
And then there's some other factors too, like what was going on around the time that patient had pain, right? Do they have maybe something traumatic in their life happened right exactly, and they didn't really think about it, and they just attributing everything to that one thing that happened.
One incident.
Right. But really it's a cumulative thing that's happening around there. And then what we treat mostly is the active lifestyle, right? Or how active are they? Because we do know that active lifestyles can help to desensitize pain. That's how we return people back to a full lifestyle. So treating somebody with chronic pain, you have to take all of these things into account. If somebody comes into my clinic and they're just like, oh, my shoulder hurts, and I just focus on that shoulder,
right,
I miss this huge opportunity to address all of these things.
Yeah.
So that's where a comprehensive assessment really comes into play, and what you guys do at the Flowers Institute is to uncover those things, right? We can't do it alone, because as you know, there's so many complexities to pain.
Yeah.
Right? And we teach people that there's just a different lifestyle and a different way to address what's going on, right? So one example we give, it's like this cup here, right? This is their capacity to handle stress, right? You pour a little bit of water in, that's their injury that they're dealing with now. You pour a little bit of stress in their life, and all these different stressors, how their fear of returning, right? Playing with their grandkids again.
Absolutely. Yep.
So there's two ways to address that, right? You can reduce the amount of fluid in the cup, right? Reduce their stress, which you guys do a great job of, right?
Yep.
Helping them understand what's going on, right? Or you can increase the capacity of the cup, right? And there's both ways that you can do it, and we try to do it on both ends. But you can't do it without the collaboration of a team.
That's right.
So
attacking it from a multidisciplinary approach.
Right. Yeah. And that's why we love working with you guys at the Flower Health Institute, because so many things like this get missed in the medical system, because they get 5 minutes with their orthopedic surgeon, or their aunt told them that they had back pain one time 20 years ago, and they think that they're going to have that exact same experience. And the research shows us it's just not like that. We're so resilient. Our bodies can handle so much, and once you teach somebody that they can do that, it's really, really powerful and empowering.
It is. I hadn't thought about doing this on the show today with you, but I'll throw something at you real quick. So we share a patient that's a long-term patient that's been here for about a year and a half at this point. So without mentioning any names, you and I are working with her on a multidisciplinary program. But talk about that initial, I believe there was an initial trauma as well, initial injury and a traumatic event, and then this long-term pain issue, and where she was and where she is now. Talk a little bit about what your approach to someone like that is.
Yeah, for sure. So the first thing that you have to do is you have to gain their trust, right? You can't tell them that their pain is not real. Because that's the first way you're going to lose a patient.
That's right. Yeah. Because they've been told that.
And so many people in their lives have already told them that, right? This is not real. Like, I've had shoulder pain. You shouldn't have this type of pain. Like, that's the first way that you can catastrophize that situation, is to tell them that they don't have that pain, right? So it's very delicate, right? And as treatment plans go, you can draw up the perfect treatment plan, hashing out all these things: nutrition, lifestyle, coaching, like activity, all these things, stress management. But at the end of the day, the patient has to be the one to activate it. Right? We can only do so much. We can show them the plan, but if they're not willing to put in the work to do it, that's going to be the first barrier, right? So I know exactly who you're talking about, and you could see that she wanted to be there.
Yeah.
She wanted to do that, and she put the work in.
Right.
We didn't do that.
Oh yeah.
We just we showed her the way.
Right.
And that's the most important aspect of it, is you've got to create that trust between the clinician and the patient. And that's where it all starts.
Yep.
Because once they buy into it, then you can start moving forward.
Yeah.
And like you said, we've been working there for a year and a half. That's a long.
now.
How many patients do you know that are willing to put that time in?
Not many. Yeah, not at all.
Not all.
And Robin, this was a patient that flew here from the West Coast on a medevac jet and couldn't even really feed herself when she came. And Dr. Clay agreed to come over, and he would visit with her every day in person all throughout COVID.
Could she walk?
And no, could barely walk.
Yeah, she wouldn't walk. She wouldn't wash herself. She would try to look around, and she could only use her eyes. She literally could not move her body.
Yeah.
Was it all up here?
Well, that is the idea, but I mean, not to her though.
Sure, that's right.
It's everywhere. It's
Right.
everywhere to her. So
Absolutely.
you have to start to unravel those things. Like if she just comes to me in that condition, there's nothing I can really do, right? I need somebody like Flowers Institute to start to unravel some of those intertwined emotional connections that she has with pain and things that have been going on for years and decades, and things that she never even knew.
Yeah.
Right? Something happened in her childhood that's now causing her to have this just catastrophic reaction.
Yeah.
And it's like,
and the pain is real. It
Yeah.
was a real legitimate injury, but the intensity of the long-term pain is so high based on the nervous system reaction and trauma. And so here she is a year and a half later, along with his help and the rest of the team's help. But at a minimum, she walks 3 miles a day, sometimes 5 miles a day.
she's working out every day. I mean, I've
full range of motion.
it's just unbelievable. Like that's why we do what we do.
Yeah.
Like when you see patients' stories like that, it's really motivating. And when you can see somebody change and it just starts to click for them, like that's why we do what we do when we put the work in. You know, and it's those type of people that we really like to help. You know, because they want the help so bad.
That's right.
But they've just been led down so many wrong paths. And,
Right.
Yep.
Mismanaged.
And not listened to. And what I've found is if you have the time to listen to a patient, they'll tell you what's wrong.
Yeah.
Like they will tell you what is wrong with them, but you just have to listen. Patients get so much stuff jammed down their throat from the medical system. They're just so broken by the time that they get to you.
Including the quick fix pill that you like to talk about.
Oh, yeah.
Yeah, for sure. I mean, that kind of goes along with our society and our culture and things that, you know, we're not going to be able to unravel all that stuff.
That's
but
right.
they come in and they want to get fixed right now.
Yeah.
Like,
immediate gratification.
you tell somebody that's, you know, successful businessman or woman, you know, and they got all this lifestyle stuff going on. They got kids. They're trying to work. They're doing all this stuff, and you tell them that their pain is because of stress. They're gonna walk out of your room.
Yeah.
They're like,
absolutely.
Well, I can't do anything about that.
Yeah.
Like, well, yes, you can.
It's my lifestyle.
It's I'm not gonna change. What do you mean? You want me to change?
Yeah.
Like, yeah.
Yeah, I do.
If you want to be here,
Yeah.
this is what it's going to take, and this is why you're here.
Yeah.
So
That's right.
And we end
I
up
think-
with all those folks that
Yeah.
ended up taking those pills that can't
Right.
get off of them,
Yeah.
right?
Yeah.
And start
Absolutely.
abusing them.
And
Yeah.
well, we talk about it's a metaphorical pill, but it's also real pills too. And when we say a quick pill fix, they just want results like this.
Immediate gratification.
Yeah. They're like, oh,
Fix me now.
Fix me now.
Yep.
Right. They don't want to put the work in to get to where they want to go.
Right.
And we can, like I said, you can lead a horse to water, but you can't force them
Exactly
to
right. Yeah.
take action.
Yeah,
you know?
that's right.
So take us through your average physical therapy session. What should people expect when they come to see you?
Yeah, so that's a really good question. It really depends on obviously what they're coming in for, right? Say we unravel all this stuff and we lay it all out for them. They're all bought in, you know, they're ready to get going. You know, as a physical therapist, we're very, very good at treating pain, right? So somebody comes in and they have pain around a certain area, say it's their lower back, right? we're going to work that lower back. We're going to do some soft tissue work, some manual techniques. Maybe it's spinal manipulation, maybe it's dry needling, maybe it's Graston stuff to calm down that central nervous system around the area, just to relax it so they can move and they feel like they can move, right? After that, it's really important. We call that a reset. So we're trying to reset their nervous system so they can tolerate movement, right? Because movement at the end of the day is what's going to get them better.
Yeah,
it's not me.
Yep.
I can't do that. Passive things are very, very short-lived. You have got to get somebody moving, and they have to be active, right? So the next thing we do is we try to correct their movement patterns. So if they have a faulty movement pattern or something where they're not moving right, and that's creating some increased pressure or tension somewhere along the body that we can address, right? So we're going to do that with some corrective exercise. And then what we do at the end of that session, right? Sometimes it's not in a full session. Sometimes they need multiple sessions of soft tissue work to desensitize the nervous system and to feel safe to move, right? So we'll do that as long as we need to. But the ultimate goal is to connect their rehab program to functional movement patterns, whether it's getting them back to squatting, getting them back to deadlifting, getting them back to running, right?
Yep.
But it's not about what I want them to do. It's about what they want to do, right? They come to me with a goal.
Yep.
I want to get back into doing this.
Yep.
So everything that we do is driven to getting them back to their goal.
Yep.
Right. And it's our job to have them set realistic expectations. So that, again, the quick pill fix, it's not like that. We're not going to do that. We're gonna draw out this treatment program, and at the end of it, you will be here if you buy into this program.
That's right. Yeah.
Right?
Yep.
So that's what we do in a typical treatment program is we get them from passive treatments to active as quickly as we can.
Yeah.
Because
Absolutely.
what we don't want to create is a system where they're reliant on us as providers. I don't want them to come in here and feel like they're broken, where I'm adjusting them and I'm putting them back in place, right?
Yeah.
That doesn't happen, right? And so many different professions make them feel like that, right? They go in for adjustments twice a week, or they'll go get soft tissue massage, and they just lay there, right?
Exactly.
They feel good for 30 minutes, and they get out, and then what happens, right? But that's not how you get better. You need to have an active program for active problems.
Follow a plan, just like everything else.
That's right.
So you were talking about deadlifting. You say that weight training really changed your own life. Tell us about that.
Yeah, absolutely. I mean, there's so
you don't
many.
really look like you lift weights, but
No, I was going to say.
Yeah,
he needs to go to the
I figured I was going to start. I was going to start next week.
Yeah.
But,
how did weight training change your own life?
Yeah, I mean, there's just so many benefits to getting into the gym and building some self-confidence, right? From a mental perspective, it's unmatched, right? It's those endorphins that you get from pushing yourself to another level and understanding that you can do that, and that's you doing that.
Right.
There's just so much power in that.
Right.
Right. For me personally, I didn't really have that issue, although it was a great confidence builder for me throughout high school and college, and I played college football and ran track, and so it was obviously in that perspective it made me a better athlete and a better person.
Yep.
I made a lot of friends that way. It was great camaraderie with a lot of different people, and it's led me to where I am today.
Yep.
And honestly, that's what has gotten me to where I am today, is just learning my own body and helping other people understand theirs. So,
and I think that your body has a lot to do with your up here understanding the human condition, right? How do you think physical therapy in your own life, working out, fitness, has changed your own human condition up here in your head?
Yeah, I mean, the more that I do it, and the more that I continue to educate myself on what I know, the more I research and stuff, I feel like the less that I know.
Yeah, right. Yeah, exactly.
I'm not afraid to tell people that I don't know.
Yeah,
and that's
right.
That's a big thing. Like when I first got out of school, I thought I could treat the world.
Right.
I thought I could help every
Without
single
do
condition.
anything.
Well, I thought I was like, oh, I know what that is. Like, get over here.
Right.
Let me stretch that out. Now it's like when I meet you and I meet other providers and start to take a holistic approach, it's like, man, I don't know much. I'm gonna do the best I can.
Right.
But I know the people.
Yep.
I have a great network of providers.
Yeah.
Right? So if I can't do it, I know where to send them immediately. I'm not going to keep
Right.
them in a system where I can't treat
Yeah,
them. And
exactly.
that's important. And understanding the human condition is understanding that everyone's different. Everybody
Yeah.
has different needs. You cannot put somebody in a cookie cutter program and expect them to do the same thing that somebody else did.
That's exactly right. Yeah.
And that's how
Yeah.
we treat, and we understand that, and we appreciate people. Like, people
Yeah.
trust us with their health,
Yep.
and I don't take that lightly.
Yeah.
Like, they could go
That's right.
they could go anywhere else, and I'm just so appreciative of where I am today, and for people trusting me with their health, and
Yeah.
for you sending us patients and understanding that.
It's great having you a part of our
Yeah.
part of our team. How is it working daily with your own brother? How's that worked out?
Good question.
Yeah.
You guys seem to get along fantastic, by the way. No
Yeah.
other reason to ask you that, but
Yeah, sure.
Yeah.
I mean, a lot of people will tell you don't get into business with family.
Mhm.
You know,
Yeah.
I would disagree. I mean, I couldn't
Yeah.
imagine talking to somebody else the amount that
Yeah.
I have to talk to my
Right.
brother. I mean,
Yeah.
we talk every day ad nauseum,
Yeah.
constantly.
Yeah.
It's about, and we enjoy it. We
Yeah.
love doing it. It's
That is
something
so cool.
we've built. We come from a very small little farm town in upstate New York where nobody really gets out, and it's just been great to build the practice that we've built together, and
Yeah.
we trust each other 110%. Like, I don't have to look over my shoulder
Yeah.
or anything
Yeah.
like that. And
Absolutely. Yeah.
that in itself is a stress relief. As you know, running a business is very stressful.
It is.
So
Absolutely.
the last thing you want to do is worry about internal issues.
Yeah. And you have a very unique approach to practice. So you do your practice in a different way, like we do our practice in a different way.
Yeah.
You're a concierge physical therapist. Do you want to talk a little bit about your practice and what clubs you're in, or?
Yeah, sure.
Yeah.
You know, the clubs have been great to us. The Houstonian, as you mentioned before, we're also at, Fit, River Oaks,
Yep.
Houston Racket Club, and the Briar Club right now, and we're looking to expand.
Yeah.
But what makes us unique is it's not only the quality of care that we
Yeah.
provide, the one-on-one time that we have with our patients.
Mhm.
Because if you know physical therapy, if you ever have been through it, if you get stuck in a system, like a bigger hospital system, let's say, like, you're going to be treated with 2 or 3 other patients in the same hour, right?
Yeah.
And it's not the therapist
more. Yeah.
right? It's
Yeah.
not the therapist's fault because it's
Yeah.
the system, but you get 15 minutes with your patient, and then you
Right.
pass them off to a tech or a
Yep.
PTA, right?
Yep.
So me talking to you about all of this complexity of pain, what are the chances I'm going to uncover that
Yeah.
in 15 minutes?
Right. Minimal.
And
Yeah.
how many people go there and they
Right.
say, I've tried physical therapy?
Yeah.
That's not rehab. That's not physical therapy.
Right.
Until they've tried that. But what happens is they'll go to their doctor. The doctor will say, well, if they're lucky, they'll say, let's go to therapy.
Mm-hmm.
And they'll go to that place for 4 weeks, and they'll come back and be like, well, it didn't work. I tried.
Yeah.
It's like, no, you didn't.
It is so wild to hear that time after time after time.
Yeah.
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 But another thing unique about the model is we get to catch patients before they get stuck in the system.
Yeah.
Like they come into the clinic with questions. They say, hey, I just hurt my shoulder. What do I do?
Right.
And we can educate them, because that's the biggest part, is just educating them on what they're about to deal with.
Yep.
So they can set their expectations properly.
Yeah.
And they're not like so apt to. And again, I'm not talking down
Mm-hmm.
doctors
No,
or
not at all.
anything
Yeah.
like that. But because of their lack of time with the patient, they're going to send them for imaging. They're
Yep.
going to put them on a medication.
Mhm.
It's going to be weeks before they can even get back
Yep.
to them.
Yep.
They're going to come back still in pain because
Yep.
they told them to rest, ice, and sit there and do nothing.
Yep.
Right.
Right.
And that exacerbates pain.
Yep.
As we
That's
know,
right.
right?
Yep.
They 10% of people that actually go to the doctor may get referred to physical therapy.
Yeah.
90% of
Wow.
patients that go to the doctor in pain will never even step foot in a physical therapy
Right.
clinic.
Yeah.
Right? So they go in with some type of lower back issue. Let's say it's
Yep.
really, really common. And the reason why they have lower back pain is because of something else that's going on.
Right.
Right? And
Like a weak core.
right.
Yeah.
Or, they're trying to squat and their ankle's really stiff.
Right.
So now they're bending forward, or,
Yep.
their shoulder mobility sucks. So
Yep.
now they're extending in their,
Yeah.
just on and on and on. We could talk about that stuff, but with a proper movement diagnostic and the proper plan of care and
Yep.
educating people,
Yep.
you can really get ahead of chronic chronic issues.
That's right.
And
Yeah.
that's
Cut
why
it off.
we kind of cut it off, and again we have the network of providers that understand what we do.
Yeah.
So I refer patients out all the time. I'm not trying to keep people just to keep them for myself. Like I want them to get them on the right path.
Yeah.
Right.
Yeah.
So I will send them to the right orthopedic surgeon. I'll send them to the right,
Yeah.
mental health
Absolutely.
place. So.
Yeah.
Do you have to be a member to go to the clubs that you're in?
No, you don't. You don't have to be a member. One of the clubs you do, but we have multiple locations for that reason, and
Okay.
so you don't have to be a member to come see us.
Mm-hmm.
What's the most, as far as issues that you see? What's the most? I don't want to
Common.
use the word. I was going to say popular. I don't want to
Yeah,
say popular.
common.
Popular.
Common, yeah.
Yeah. I mean, it's by far it's lower back pain.
Yeah.
Is it?
Just
Yeah.
people have all walks of life have lower back pain. 80% of people will have low back pain at some time in their life, right? So that is the most common.
Yeah.
A lot of our two of our clubs are tennis clubs, so we see a lot of shoulder, elbow stuff like that.
So you're also very innovative in your practice, and you're always looking at ways to evolve, and you're always looking at ways to expand the patient population that you see. And I know now you've expanded your practice to include pelvic floor therapy, as well as pre and post baby training for moms and dads. What's
Yep.
going on with all of
Awesome.
that?
Yeah, so
it's
that's
so cool.
That's
Yeah.
really exciting. We're just trying to find a way to reach more people and have them exposed to the type of care that we can provide to them.
Yeah.
Pelvic floor is not my expertise, but I know how to find the right people that can do that.
Right.
But what I do know is how underserved that community is,
Yeah.
and how much they can benefit from just education and understanding, and having somebody touch them in a comfortable climate, where they don't feel like they're in a doctor's office and they're getting exposed. We teach them how to
Right.
function properly, and we teach
Right.
them how to get back into weight training. A lot of moms are just scared. They're scared pre and
Yeah,
post. Right?
absolutely.
They don't feel like they can get back into doing what they once did. Right?
Yeah.
They feel like it's, this is normal. This is my life now.
Yeah.
And what we know is that that's not true. You can train into your third trimester. Right?
Yeah. Wow.
Obviously, that program changes as you
Yep.
go, but you need to develop the fundamentals and understand how to move before that happens, because when it does happen, things happen. You got it. That's part of it, and afterwards, it's proper education and getting you back as quickly as you can. Working with the doctors, right? We don't overstep our boundaries, and we don't tell them to do things that they're not cleared to do. But we work with the doctors again to make sure that it's okay for them to do that, and we get them back as quickly as we possibly can. And that's just something that we it's a new program for us, and we're really excited to roll it out.
Very
That's
cool.
cool.
So we're almost out of time, but we wanted to ask you a couple of personal questions. What's on your bucket
Sure.
list that you haven't done yet?
Oh, my bucket list. Well, I love to travel,
Yep.
and this past year has been a little difficult to travel.
Yeah.
So,
Sure has.
definitely getting back and just getting some relaxation time. I love
Yep.
the beach. Love
Nice.
to
Yep.
do active things outdoors, and luckily I was able to get out skiing once this year, which was a blessing.
Yep.
It was
Awesome.
really 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 nice, and
Yep.
that's on that bucket list for sure. And business wise, like I would love to be able to provide care, not just here in Houston, but throughout the country with that model that we run, and it's effective, and I know it can be done. So.
Well, you know what? We have another former patient that we worked together that owned a huge physical therapy practice up Midwest, I guess.
Yep,
You can
Ohio.
always call her and say, hey, how'd you grow that large?
Oh yeah, we still talk. Actually.
Yeah, she just called the office this week. Checking in.
she's a sweetheart.
Yeah,
Oh, cool.
she's in a, boy, talk about a difficult woman, right?
Oh my God.
Dr. Hill thyself, right? She's a physical therapist.
Yeah.
Or no, was she a physical?
She used to, just for a very
brief time, and became an entrepreneur and grew this huge physical therapy. I think she employed, I don't remember how many, but all
She's
across
got
our state.
almost 1,000 patients.
Clinicians, yeah.
Oh my
Huge.
gosh.
Yeah, massive
yeah.
scale.
Yeah, but boy, what an amazing change that she had in her
Oh my
life
God,
as
yeah.
well.
We see that all the time. Like,
Yeah.
it's just we almost get numb to it, but you got to take a step back and
I know.
just realize, like, wow, we're really changing people's
We
lives.
are, and enjoy the wins, because occasionally there's one,
Oh, for sure, yeah.
you know, that we're
Yeah.
not going to win, no matter how hard we try. Well, we
Yeah.
absolutely love working with you.
Yeah.
Our patients love working with
They
you.
do.
The other providers really like your feedback, and it's, I believe, invaluable to the services that we offer. You have to be part of our multidisciplinary team. So
Yeah.
thanks for being here.
For
Thank
sure,
you.
yeah. Thanks,
Yeah.
thanks for having me.
Anything we didn't cover physical therapy wise that you
No,
want
it
to
was,
throw out there?
this was good. It's kind of, again, it's a different take on physical therapy.
Yeah.
It's just people don't really understand. The biggest, the challenge that we fight is that people just don't know what physical therapy is.
Right.
They think it's like sitting in the corner pulling on bands and like
Yeah.
handed a sheet of paper, and you know, it's like
Yeah.
that's what they used to
That's
do.
old school.
Yeah.
But
Yep.
unfortunately, there's still a lot of practices that still do that,
Yeah.
and
Yep.
you know, we're trying to break that mold and help people understand that there's a better way.
Yeah. Absolutely. Yeah.
Well, and
Yeah.
if someone wants to reach you, and they can actually watch you in some of your videos on your Instagram, but
Yeah.
how do they find you?
So you can find me on my personal Instagram. It's Dr. Clay Fit, or you can use our business Instagram, which is SculptU_official, and then our Facebook is SculptU.
Nice.
So-
And
the website?
U is just the letter U.
Yes,
Right.
just the letter
Yep.
U, and our website is Sculpt, SculptUPT.com.
There you go. Yeah.
Gotcha. And if
Yeah,
they
yeah.
want to reach you, Dr. Flowers, at the J. Flowers Health Institute,
jflowershealth.com.
Awesome.
Yeah.
It's a lot
Right.
easier than
It-
mine.
thank you again.
Absolutely.
Dr. Clay.
Yes,
Thank you
guys.
so much for being here.
Yeah, it was fun. That was a lot of fun.
Absolutely. Thanks,
Bye.
Robin.
See you next week.